Hi, Mrs. Woods. My name is Brianna. I'm a FNP nursing student at Seattle Pacific University. I'll be taking care of you today. Can you tell me what brings you in today?
Yeah, I've got a headache that started this morning about 9 o'clock.
Okay.
It became severe really quickly.
Okay. I said 9 o'clock this morning. Okay. What were you doing at the time?
I wasn't doing anything new that I can think of, except I went out with friends last night and had 2 glasses of wine, and I don't usually drink alcohol.
Okay. Did you? How you said 2 glasses?
Yeah.
Okay. So did this headache, was it like upon awakening this morning, or were you already awake?
I was awake, and when I first woke up, it was really, well, at first it was worst on the right side of my head,
Okay.
and it felt like a painful throbbing behind the right eye, and now everything hurts.
Okay, so when you first woke up, it was on the right side of your head?
Yeah.
Okay, and then it radiated to behind the right eye?
Yep. It was a throbbing behind my right eye.
Okay, throbbing. And now it's just all over?
Now everything hurts.
Okay, when you say everything, or is that including your body as well?
Yes.
Okay.
Well, just all over my head.
All over your head. Okay,
Yeah.
thank you.
Not just behind my eye, like all over my whole head.
Okay, all over your head. Okay. Let's see. So, what were you doing when you first noticed it?
I had just woken up.
Just woken up. Okay. Does anything make it better?
A cool washcloth on my forehead and lying down in a quiet, dark room.
Okay. And does anything make it worse?
Bright lights, noises, and bending over makes me feel like my head's gonna explode.
So, bright lights, noises, and bending over?
Mm-hmm.
Okay.
Makes me feel like my head's gonna explode.
Okay. Okay. And so have you taken any medication for it?
I took ibuprofen,
Okay.
200 milligrams,
Okay.
and Tylenol, 1,000 milligrams,
Okay.
today at noon, and it didn't help. Not much, anyways.
Okay. So ibuprofen 200 milligrams and Tylenol 1,000 milligrams at noon,
Yes.
and it did not help.
No.
Okay. Okay. And you said that behind your eye it was throbbing. So now that it's all over, what does it feel like?
Well, I would say that it's still severe pain.
Okay.
It hasn't gotten any worse, but it hasn't gotten any better over the past few hours.
Okay.
And I would just still say it's a severe throbbing pain.
Okay, severe throbbing pain. What is the pain? What is the sensation? Is it sharp? Is it dull? Is it aching? Is it throbbing?
It's just aching all over.
Okay. Let's see. It's aching all over. Other than it starting to radiate all of your head, does it radiate to any other parts of your body?
No.
Okay. And on a scale from 1 to 10, how severe is your headache? A 10 being the worst pain ever.
It's a 7.
It's a 7. Okay. And you said it's not getting better and it's not getting worse.
Right.
Okay. Okay. So Do you have any other symptoms? Are you dizzy at all?
Um, I have been nauseated and a little lightheaded, and I wasn't able to eat my lunch. And I don't have no dizziness,
Okay.
but I am lightheaded.
Okay. Any loss in any coordination? Like if you try to walk, are you having any loss of coordination?
No, and I haven't had any visual changes.
Okay. Okay. So you said this headache has been continuous from 9 o'clock until now, correct?
Yeah. So I've had it for about 10 hours.
Okay, perfect. Have you ever had a pain like this before?
I have bad headaches maybe every 3 to 4 months, and sometimes over a year in between them. But usually I can lie down and go to sleep and it's gone.
Okay. Okay, and how are those headaches? Do you have any type of aura or any history of migraines?
So I've had headaches like this since I was about 20. And before this headache, I did have a brief period of seeing twinkling colors just before the headache started. And I have seen lights before some of my prior headaches too.
Okay, so you said a brief period of. Can you repeat that for me? A brief period of.
Twinkling colors. I saw twinkling colors.
Okay.
And I've had that before.
Okay. So you said a brief period of twinkling colors, and you said something about lights.
Well, sometimes before some of my other headaches that I've had like this, I've seen lights before.
Okay. Thank you for clarifying that. Okay. And how long did these headaches last?
It kind of depends, but 10 hours seems like a long time.
Okay.
Like I said, usually I can just lay down and go to sleep and it's gone, but this one's just not going away.
Okay. What I wanted to know is, in the past, your headaches in the past, how long have those lasted? Do they usually last about 10 hours?
No,
or
10 hours is a long time.
Okay. Okay. And you've been able to just go to sleep, and that'll relieve the headaches in the past.
Right.
Okay. Did you take any medication for those headaches in the past?
Probably just the Tylenol and ibuprofen.
Okay.
And then went to sleep.
Okay. What do you think is going on?
Well, I suspect a migraine, but this is lasting a lot longer than most of my headaches.
Okay. What I'd like to go ahead and do is do an exam on you, and then we'll try to figure out what's going on, okay?
Okay.